There's a treatment out there that's fairly popular, becoming more and more popular, and that's called dental tourism. It's not unusual to hear stories of people that cross the border, they head to Mexico, head to Thailand for cheaper dentistry. Another kind of dental tourism isn't someone that's looking for a cheap alternative, but a better quality. For some people, distance is not a barrier to get the best possible treatment. In my office, I will occasionally have people travel from very far away, even internationally, to get what they feel is the best treatment. However, the process can be lengthy, and so to save some time, we have a few tips. Now, many times a smile makeover or an all-on-4 treatment are multiple visit. It's not a single visit to get the treatment. Some patients will do a long vacation in Seattle, and we can help with vacation planning. However, sometimes it's multiple visits, so we try to minimize your airfare expense. Right next door to my office is a hotel, and we share a parking lot. So we can help coordinate treatment and hotel accommodations to minimize the confusion. Now, sometimes the first visit is a lot of diagnostic records. And to minimize one trip, we have a few things that can be done. You can have a local dentist go ahead and take x-rays and maybe some photographs and have those emailed to me for evaluation. We can Skype, phone call, or email some back and forth to figure out what would be the best and most ideal treatment. If the gum health or the periodontal situation is not healthy, we would want that to be addressed before traveling to my office, and your local dentist would be able to help with that. The local dentist would also be able to take what we call PVS impressions, or impressions of the teeth, PVS polyvinyl siloxane. Every dentist would know what that is. Have those taken, have those sent to me, and we can then do what's called the diagnostic wax-up or treatment planning for study models. We would also then need a bite registration to help evaluate. For a smile makeover, you're going to want to look on my website for the different smile styles to choose from. Pick a style, and then we can have the lab get that waxed up. We'll want a clearance from your local dentist to make sure that if there were any root canal therapy or periodontal situations or anything else that needs to be addressed before we do treatment, that we have that completed in advance. Now, sometimes some dentists, their version or their opinion of healthy is different than ours. And so if on your first visit we determine that maybe a little extra needs to be done, we'll make sure that that gets taken care of before we start. We're not taking any shortcuts. We're not cutting any corners. We're still going to make sure that you have a healthy dentition before we begin. A typical smile makeover, if the records are done in advance, is 2 visits or 1 long extended stay. The first visit would be several hours when we prepare the teeth for the veneers and make provisionals or a prototype smile for you to help evaluate your treatment, evaluate your smile. And then after the lab completes their work, we have the next visit is when we bond all the teeth together, all the veneers individually, and get them polished and adjusted. Before you return home, we would then polish your teeth to make sure that the teeth and gums are healthy and adjust the bite to make sure everything is balanced and comfortable. If a perfect smile is your goal and you don't feel that your local dentist has the capability to give you what you're looking for and would like to travel and have us give you the best possible care, give us a call. Our information is below.